Cancer doesn't discriminate, but the healthcare system often does.
Amanda Boulderston has faced barriers to accessing cancer screening because of her sexuality.
When I used to go to my GP, they used to tell me that as a lesbian, because I wasn't having sex with men, I didn't need to go for a PAP. Which isn't true.
The radiation therapist is also a researcher at the University of Alberta. She says the LGBTQ2 community not only faces barriers to accessing cancer screening, but sometimes lacks access to treatment and support after diagnosis.
Say a trans woman with prostate cancer may find it very difficult or alienating to show up to a face-to-face support group with cisgendered men with prostate cancer.
Boulderston says disparities are caused by a lack of education in the healthcare system. She adds the gap is also caused by a combination of social and economic factors, many of which can be traced to the stress of living as a queer person.
And there aren't specific information and support resources for them, and it's often a struggle for them to find useful information.
It's one of the reasons why Boulderston and her colleagues created the website Queering for Cancer, giving those a support system while they go through one of the most difficult times in their life.
And chat forums so people can connect. And it also contains a growing repository of stories so people can read about each other's experiences.
Queering for Cancer launches Tuesday and will include a fully searchable database of cancer resources specific to LGBTQ2+ individuals. In Edmonton, Rachelle Elsiufi, City News.